Bismillahirrahmanirrahim. I start the CME with the name of Allah, the most beneficial, merciful, and very kind. The CME update by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq, Family Emergency Ops and Gynae Specialist, presently a district gynecologist. We will talk about the discharges, genital discharges, vaginal discharges. They are very common, physiological at the reproductive age group, and can be related to the menstrual cycle and the hormonal changes, and also to the pills. They can be physiological, which are estrogen related. It can be due to COC pills, pregnancy, and can be cycle related, and can be due to, these are physiological. And then there are some pathological one. Pathological one are due to non-infective bacterial vaginosis and candida, and pathological are infected are the TB, chlamydia and gonorrhea, sexually transmitted diseases. Now the associated factors are very important. The characteristic associated factors: color, discharge, odor, smell, and their symptomatology. Mostly they are asymptomatic. If it is related to some foreign body, is there, like tampons or some retained tampons and other things, foreign bodies, some precipitating factor, some sexual excitement and arousal, also due to associated factors, precipitating factors. There are some allergies, dermatological conditions, malignancies. All these are, there's a medical history of diabetes and immunocompromised, sexual history, sexual excitement, and sexually transmitted diseases. Then can have the diagnostic test. These swabs can be endocervical, vulvovaginal, high vaginal, low vaginal swabs can be taken and analyzed accordingly, like bacterial vaginosis, flu cells are there, Trichomonas vaginalis, strawberry cervix is there, and similarly gonorrhea, gram negative, and chlamydia obligate protozoa, in which the BV, bacterial vaginosis, and candida are non-sexually transmitted, while Trichomonas vaginalis and this chlamydia and gonorrhea, they are sexually transmitted diseases and have their implications systemically. The third one, then the examination, they can obviously, they have ulcers, erythemas, swelling, allergies, and all vulvitis, urethritis, and pelvic inflammatory disease, lower pelvic infections, and then pelvic inflammatory diseases, and can have speculum examination and the bimanual examination. Can see the state of the internal genital organs. It can take the swabs, high and low vaginal, and others. And then by manual examination, you can feel the tenderness, you can feel the inflammatory changes, and also cervical motion tenderness. Treatment of these discharges are accordingly. We are tested with the high and low vaginal swabs, and also the pH of the vagina, and the most important, in the gums clinic they are available as gums clinic, they are wet mount preparations, so you can check, but these are not there in the gynecology clinic. For bacterial vaginosis, blue cells are there, and it's having severe itching and soreness, dysuria, and superficial dyspareunia. Treatment, of course, diagnosis we have touched, is metronidazole, stat dose 2 gram, 400 milligram for 5 to 7 days, and these metronidazole creams. For the trichomonas also, the treatment, it is also bacterial vaginosis causes severe itching. Candida also causes severe itching. Bacterial vaginosis having grey white discharge, while candida is white, curd-like, ascending on the walls of the genital organs, vaginal walls. And for candida, the treatment of choice is clotrimazole, fluconazole, the pessaries, ointments, and oral tablets. Fluconazole is contraindicated in the pregnancy. The trichomonas vaginalis and chlamydia and gonorrhea, as I've told you, they are sexually transmitted diseases and have their implications in the pregnancy, preterm labor, preterm rupture of the membranes, low birth weight babies, and similarly preterm miscarriages, preterm labor, and preterm rupture of the membranes. These are quite common in pregnancy and have their implications in the pregnancy. For chlamydia, it's also very common. It's an obligate intracellular organism and is commonest, and it has screening is done. And also for sexually transmitted infections like trichomonas, chlamydia, and gonorrhea, contact tracing of the partners is very, very important, and then their treatment is also very important. Both the patient and their contact partners must be treated in order to have the full therapeutic effects of the treatment. Then chlamydia discussed, treatment is ceftriaxone and azithromycin and clindamycin, doxycycline and azithromycin are given for 5 to 7 days depending upon the infection. And the third one are the gonorrhea, and then for gonorrhea these antibiotics are given like ceftriaxone and others. So these are the, and in very important are the maintaining of the self-hygienes and wearing of the cotton clothes so that they should not be involved in any allergies, sitz baths, heavy douchings and other shampoos and other heavy douchings, chemicals and other things, they are avoided because they can increase these discharges and allergies and inflammations and erythema. So healthy lifestyle, prevention of intake of water and sitz bath and cotton clothes, they are very effective in dealing with this. We'll review in detail about all these infections, vaginal infections. I told you physiological is clear white, and the bacterial vaginosis is green gray. Trichomonas vaginalis is gray green, and there are malignancy as well. It causes purulent discharge. Foreign body also cause offensive discharge, blood stained discharge, and other things, uh, foreign bodies, and retained tampons, and these also, and malignancies are the some of the causes which count. So they are treated accordingly. Most important is sexually transmitted disease, in which the contact tracing in the partners are also treated. So takeaway lesson is praise, trust God Almighty Allah, and follow the lifestyle of Hazrat Muhammad sallallahu alaihi wasallam, our health and survival. And we must not forget the glorious past of the Muslims. दो नीम इनके ठोकर से सहरा और दरिया, सिमट कर पहाड़ इनकी हैबत से राय. And most important things, always ask from, keep praying God Almighty Allah. हम तो माइल बकरम है, कोई साइल ही नहीं, राह दिखलाएं किसे, राह बर मंजिल ही नहीं. वमा अलैना इल्लल बलाग. Thank you very much. Dr. TMK will come with another CME.